Is everybody ready? All right. My name is Hannah Bleem. I'm the External Affairs Officer for the Williamson County Emergency Management Agency. I will be facilitating today's press conference. We're here to discuss the announcement of the state's first confirmed case of coronavirus and what it means for Williamson County. As indicated on your agendas that we handed out before the conference, our speakers are from the State Department of Health, the Williamson Medical Center, Williamson County Schools, Franklin Special School District, Williamson County Emergency Management Agency. After each speaker introduces themselves, you're free to ask questions in between. We ask that you keep it to 2 to 3 questions, then we'll move on to the next speaker. We will be allowing questions at the end of the conference. We're just hoping this will help the press conference move smoothly and quickly. We'll start with Dr. John Dunn from the State Department of Health.
Good afternoon. Thank you for the opportunity to be here today to talk about this evolving situation. So as you know, the Tennessee Department of Health received positive tests on the first case of COVID-19 in Tennessee. The State Public Health Lab tested the individual yesterday and has submitted results to the CDC for confirmation. We received results late yesterday afternoon. We've been anticipating identification of COVID-19 cases in Tennessee, and we've been working closely with the CDC and local health department partners. We have been in our State Health Operations Center since the beginning of January working on this. At this time, we still feel that the overall risk to the public is low. As you know, this patient is a resident of Williamson County. TDH staff have been in contact with the patient. He's currently isolated at home with mild symptoms. His household contacts are quarantined at home and are in the process of being monitored and evaluated for COVID-19. We want to thank our regional and local health department partners as well as the Williamson County Medical Center who has helped us in the past few days. It's been a seamless collaboration to make the diagnosis and implement the public health actions that we need to implement. We continue to emphasize that the current risk to the general public remains low, and the same precautions taken with flu should be taken with COVID-19. While this is a new disease, we've learned that most patients with COVID-19 infection have a mild respiratory illness with fever, cough, and shortness of breath. A smaller number of patients have severe symptoms requiring hospitalization, particularly the elderly and those with chronic medical conditions. At this time, COVID-19 is not widespread in the United States. Individuals with health concerns about COVID-19 should contact their medical providers. A growing amount of information can be found on our website at www.tn.gov/health or through other trusted partner organizations like CDC and the World Health Organizations. We want to encourage folks to go to trusted sources of information in this particular event. Lastly, I just want to again acknowledge and thank our partners at the county level with Williamson County Medical Center. I want to reiterate some of the things the governor said this morning in his briefing, that we're committed to being transparent about our response to COVID-19. We want to encourage people to be prepared. The tornadoes have been a great reminder that we want to have personal preparedness for ourselves and for our families to take care of our needs when something happens. And we also want to continue to have perspective on this emerging event. Again, we know that we're learning more and more about this particular disease every day, and that a large majority of the cases are mild illnesses. And we want people to keep remembering that there are routine things, preventative measures that they can do every day to help protect their health and the health of their loved ones. Thanks.
Are there any questions?
I was just curious, has this individual before being diagnosed, was he at all in any of the businesses in the area or anything? Do we have any concern or do we all monitor those places that he's in?
Yeah, today we released some additional information about the person's travel, and the person had flown back from Boston. They were well when they returned to Tennessee. And really, as soon as they began to start feeling bad, they self-isolated. So we're really pleased that the time in the community is very, very limited, and our staff at the state and regional and local level are continuing to work to evaluate contacts and anyone who might have come in contact with the person.
Dr. Dunn,
Yes, sir.
the airport CEO says he flew back from Boston on February 27th. Is that, are you all trying to notify everybody who was on that flight, or is that not relevant since he wasn't symptomatic?
CDC has guidance about travelers on aircraft, and primarily has to do with when they're symptomatic. We're glad to know that this person, as they were returning, were well. They were likely still in their incubation period, so they were not having symptoms of the virus at that time.
But are you all trying to contact people who are on that flight?
But we're not at this time, and that's not consistent with the CDC guidance.
Dr. Dunn, how do we know when the person is out of the woods, or what is the timeline of the progression of the disease? He's mild right now, but is that subject to change soon?
Well, it is subject to change. We're hopeful that he'll have a mild course of disease and recover. With our partners at the regional and local level, we monitor the health. We're doing something called daily active monitoring, where we are in contact every day about the patient's health and the health of the household as well. Thank you.
Thank you all. We're now going to move on to Dr. Paul Jacob from the Williamson Medical Center.
Good afternoon. Tuesday morning, Williamson Medical Center received a call from the state regarding the referral of an individual to be tested for the novel coronavirus. In preparation of this individual's arrival, a staff member wearing CDC-approved personal protection equipment met this individual outside of the center to collect the sampling needed for this test, which was submitted per protocols to the state laboratory. Following the sample collection, the individual went back home to proactively isolate while the test was pending. To reiterate, this individual never entered or was a patient of Williamson Medical Center. We want to reassure current and recent patients and visitors that this individual nor the collection that took place occurred inside the hospital. We have an interdisciplinary team of experts who have been preparing in advance of the virus's arrival in our state and continue to stay in close communication with the Tennessee Department of Health and the CDC for information and updates related to guidelines for treating and testing patients. In response to the first coronavirus diagnosis in our state, we are instituting a limited visitor approach, allowing only necessary personnel and caregivers inside the hospital. This means that we are discouraging visitors for patients at this time. This is a precautionary measure to ensure safety and health of our state patients and staff. Patients should seek medical treatment as usual at this time. We also encourage the community to remain vigilant in taking measures to stop the spread of the virus, including the following: washing hands frequently with soap and water for at least 20 seconds, or use of an alcohol-based sanitizer if soap and water are not available. Refraining from touching your nose, eyes, and mouth, and avoiding contact with those who are sick. Health and safety are always our priority. We continue to remain fully prepared and are confident in the measures we're taking for the safe and effective care for our community. For questions or concerns, the community may call the Tennessee Department of Health hotline at 877-857-2945. Again, that's 877-857-2945. Thank you very much.
Are there any questions?
Yes.
How's that test work?
I'll defer.
Yeah, the testing that's being done by our state lab is the CDC-approved test. Basically, it's a swab of the nose and the throat. Basically, it's a test called the polymerase chain reaction test. It's a PCR test that looks for the genetic material of the COVID-19 virus and identifies it in the specimen.
Jacob?
Yes.
You make it sound like you wouldn't even want someone with COVID-19 in your hospital. Why
No, that is not true. So we're prepared, and we are asking any patients who do require care to come to the hospital if they need it.
But you made clear that he didn't even enter the hospital, and that seemed intentional, right?
Correct. And the reason for that is to reassure our current patients and visitors who have been at the hospital and getting care that there isn't concern for exposure to them. So obviously that would create a lot of concern for patients or visitors who have been at the hospital. So we want to reassure any patients or visitors who have been there.
Like I said, where did you do the test? At his house or?
So the testing was performed at the state laboratory.
Oh, okay.
But where'd you take the sample? In the parking lot or something?
The sampling was taken outside of the hospital, correct.
Oh, at the hospital, the parking lot of Williamson Medical Center?
It was taken outside of the hospital.
Oh, okay.
Other questions?
Although you all are suggesting that it's very low, the risk to the general public, are there plans in place for quarantine if there were an outbreak that has come to our area?
I would defer those questions to the state.
Well, so what our state health department is doing is we've been receiving information about travelers to the high-risk areas like China, Hubei province in particular. As you know, when funneling started to airports, we started getting lists of patients. So we have been asking those individuals to quarantine, which means they're well, and we've been monitoring their health for 14 days, which is a nice buffer in terms of when the virus might actually cause illness. So those are the measures we're taking. We're continuing to do that, and as we identify cases, like in this instance, and we anticipate identifying more cases, we'll be looking at the contacts around those individuals and then advising about quarantine in those cases as well.
About this incubation period that this man had, just comment for me, is there no risk associated with the incubation period that a person may have to the people around them?
So, well, we're learning a lot about the virus, and I think the question you're asking is, can somebody be shedding the virus while they are not exhibiting symptoms? And that's not the way that diseases are transmitted typically in our experience. That's not going to be the thing that drives transmission in our communities. We wouldn't want to say that that's not possible. We're still learning a lot about these viruses, this new COVID-19 virus, but that is not the mechanism that disease transmission is driven by.
You said you're anticipating more diagnoses, right? Does that mean the two people that you're currently testing, you think it may happen again?
Well, we have tested about, I believe that the number is 10 cases, 10 individuals in our state public health lab. There have been a number submitted today. That number is going to change on a day-to-day basis. And we certainly expect, as COVID-19 expands in the United States, we've seen it, I think, in more than a dozen states now, that we would anticipate having more cases, yes.
We're going to have to move on. We'll have some time for questions at the very end for our medical and health advisors. We're going to move on to Jason Golden. He's the superintendent for Williamson County Schools.
Thank you. As superintendent of Williamson County Schools, first I want to thank Governor Lee and our Commissioner of Education and the Commissioner of Health for their leadership in this and in sharing with us the issues that they're facing with the coronavirus. From a school perspective, Dr. Snowden from Franklin Special School District and I both determined that there was some wisdom in our taking a day or two out to do some additional cleaning, some antibacterial cleaning in our schools. So we have determined that we're going to close schools Friday, which is tomorrow, and Monday to give our custodial staff and contractors an opportunity to do that additional cleaning in the school buildings.
Are you going to be educating kids just on like hygiene practices when they go back to school and stuff? Because obviously they're not as aware of keeping their hands washed.
That's a really good question. We regularly communicate with our families, both our students and their parents, about good decision making with respect to managing illnesses. Just 2 days ago, we sent a notice out to our families with those reminders that have been shared with you about washing hands with soap and water, using antibacterial materials, and those wise behaviors that you can do with yourself to protect yourself from any illness. Yes.
Some of the parents here in the county are wondering why this is happening. Even though you're saying what you're saying, I think some of them may be thinking, oh wait, maybe they can, if someone
We've gotten all the information that the state has shared with you, and so we don't have any indication at all that there's an event that's even touched indirectly our schools. However, because of the information shared with us from the state that was shared in the public address that the governor gave this morning, we determined that this was a good opportunity for us to take that extra step. From time to time, we do that in certain schools. For example, with staff, do some extra cleaning when we hear of events like that. And again, we felt like this was a wise opportunity for us to do that here.
Does he have kids in Williamson County Schools?
I can't speak to that. That may be a question for someone else at the state. I have not received any information from the state as to any name or location, anything to that effect. I just don't know.
Is it gonna be any additional training for like staff or teachers to maybe if they recognize some symptoms that seem off, or like if there's a student that may potentially be exhibiting some of these symptoms?
We have regular conversations with our school administrators and our nurses. We're fortunate enough with funding from our county commission that we have a nurse in every one of our schools. They regularly work with parents about identifying students who might be exhibiting symptoms of any illness, whether it's a common cold, the flu, et cetera, to make sure that parents are aware of that. And we do encourage our children and our parents to have their children stay home if they're ill. And so that principle applies here just as it always has.
Battleground Academy, this is one of their events, so they sent out a release. So if people say this is a bit of an overreaction, what would you say?
We have 10 days built into our calendar for inclement weather days. We've been fortunate enough this year not to have used those days because we haven't had heavy inclement weather with snow. Because our families have had this concern, because the governor has shared this, and because we have planned with extra school time over the course of the school year to do this, because there were so many schools, we couldn't do this just overnight. We felt like it was important to take the day, both Friday and Monday, to make sure we do that extra work. And there are many illnesses out there from time to time this time of year. So again, we feel like there's some wisdom in it because we have the time to do it.
Now we're going to have Dr. David Snowden from the Special School District for Franklin.
Good afternoon. We certainly, like Jason, appreciate the leadership by Governor Lee and the cooperation of all the health agencies in the state and locally. We know this is serious. We've been following our same protocols as we do with any influenza or any virus throughout the year. We encourage good hygiene, constantly washing hands. And I like to say, I had a question about younger students. Our teachers constantly supervise and encourage them to wash their hands for a certain period of time using soap. Sometimes, younger ones want to just wash it with water and they think they're good to go. But also teaching them how to sneeze and cough into their sleeve or elbow. We've asked parents if their children are sick to keep them at home and to not return those children to school until they have been symptom-free for at least 24 hours or fever-free for 24 hours. And so far we've had good success with our parents and their cooperation. So we're going to continue to ask them for that cooperation as we move forward. As Jason said, we talked this morning. We think the prudent thing to do at this point, since we do have the days built in, is to take this opportunity to really do some deep cleaning in our buildings. We're going to deep clean our buses as well. Not that we don't clean on a regular basis, but some significant deep cleaning, and in hopes that will help stave off that opportunity for the germs, if there are any of the virus germs in our schools or anywhere around in different locations that we have.
And now we're going to hear from Todd Horton, the Emergency Management Director for Williamson County.
Good afternoon. Williamson County Emergency Management Agency continues to monitor this evolving situation, and we are working closely with our partners from Williamson Medical Center, from the Williamson County School District, Franklin Special School District, from State Health Department, and also other partners in Williamson County and in the region for that matter. It is important for our residents and our visitors here in Williamson County to not overreact to this situation for this virus in our community. One of the best ways to mitigate risk is self-preparedness, and preparedness begins with each individual. So please practice good, proper hygiene by washing your hands, not touching your face, and staying home when you feel ill. We want to remind our community to remain mindful that we are actively recovering from a regional emergency related to the tornado event that just occurred in Middle Tennessee. When you consider making purchasing of supplies to protect yourself and your family, we ask that you please only purchase the items that you specifically need and only purchase the amount that you need for those that you care for. This will ensure that there are adequate supplies available to those who have been affected directly by the tornadoes and also those who are actively working to help those who have been affected by those tornadoes. We certainly want to appreciate and extend our thanks to the public for your cooperation, and anything that we can do here with the Emergency Management Agency to assist you, we are available. I'll entertain any questions.
Can you speak on Battleground Academy and the email that they sent out saying that the child of this guy lived there?
I have not been privy to that information. I'm learning about that here in this meeting, so I cannot.
Can anyone up there speak on that? I mean, I'm sure that there's people from Battleground Academy watching one of these.
So with that being said, we'll probably move on to our series of questions. I am going to ask that you please identify the agency that you're wanting to ask, since we're going to be moving across the mic. I just want to make sure that if you kind of know who your question is directed to, please state their name or agency before we start. So again, we'll start with that question. Is there anybody here that would like to answer that question?
John Dunn from the Department of Health. I've not seen the battleground statement in detail.